there has been so much remarkable efforts in the last 2 years in terms of investment in maternal health. We are currently focusing under the leadership of the Minister of Health, the Coordinating Minister of Health. We are prioritizing 172 local governments in 33 states of the Federation that contributes more than 55% of the overall burden of maternal death in Nigeria. So what has happened in the last few years, we have witnessed increased human resources, capacity development, massive deployment of essential commodities, medicines, equipment to those facilities in 172 local governments. And also a lot has happened in terms of activities and infrastructural development to be able to provide services for women and children and the general population. So it's too early to say, but from the indicators, from the hospital statistics that we are currently receiving, we have seen massive improvement in the uptake of antenatal care. Women attending antenatal care services have increased in the last 2 years remarkably, and then women coming back to be delivered by skilled birth attendants have also increased. So we hope to see changes, we hope to see reduction in maternal death within the next, by the time that we are going to have another round of survey. So all these efforts are being deployed, with so much investment in the areas that have highest maternal death in the country. And then in addition, it's not only government alone. There have been massive engagement with religious leaders, community leaders, to change the perspective, to improve the uptake of the services. Because sometimes the services might be available, but due to cultural beliefs, the norms of people, the way they do things, they might not accept services. So a lot of engagement has been ongoing with religious leaders to be able to deal with the misconceptions around uptake of maternal health. And one key game changer for Larry that I must mention in improvement of maternal health is access to quality family planning services. So the administration of President Bola Ahmed Tinubu, since he came on board, he has met the commitment. He has continued to release funding, even though we are yet to meet at the desirable level, despite the economic challenges. He has sustained commitment to the procurement of family planning commodities. And that has also translated into action in some states of the Federation, where today you will find remarkable numbers of states procuring family planning commodities, as a game changer towards reduction of maternal death in the country.
I was going to ask, just as you touched on these aspects I was going to ask if this is a pan-Nigeria affair, or there are areas where this challenge is more noticeable than others in terms of the seriousness. So, you've spoken about Sure, please, go on. Go on, please.
Yeah, so generally it's a Nigerian affair. But in Nigeria, there are hotspots area where they account very highest level of maternal death. So for instance, you take some places where you find out that generally, if I may say, it stands at about 512 women dying per 100,000, deliveries in the country. So, but if you take other parts of the country, you will get records of as high as over 1,000 deaths happening per 100,000, live births. So it differs from region to region and also from state to state. So we are not saying that all other states that do not have the highest level are not also considered. They are also sustained their efforts. They must continue to sustain their efforts. Everything happening, but there are more aggressive action in those areas that I have mentioned, 172 local governments. The indices are there. The information is available in the Ministry of Health for verification. And you will see also the intensified actions that are happening in those local government, that is the 172 local government that contribute maximally to maternal death in the country. So it's a Nigerian affair, if I may put it that way. But more focus have to be concentrated where it is most needed.
We're talking about 2 years of President Bola Ahmed Tinubu's administration, but surely that is building on something. When you people came in and started, you weren't starting from ground zero. So it would be sort of interesting to get your perspective on where we were, the foundational work that had been done right up until that you are now carrying forth?
So thank you very much. I will just briefly mention and acknowledge the efforts of the past. You know, it has been a journey in the health sector, development sector, right from pre-independence when we had the ministries established. And then we come to the period also of massive improvement around when we had the first national policy on health in 1988. And then the establishment of the National Primary Healthcare Agencies between 1992 to 2005. So we had a minister, Professor Olukwe Ransom-Kuti, who did massively in terms of establishment and then strengthening the primary healthcare facilities. I mean, not only that, these are all reforms that happened within the health sector in the past years. And also, remarkably, also there are areas where the Bamako initiative, which is about a drug revolving fund, and then ensuring that drugs are available in a sustainable manner. So a lot has happened, and Nigeria has witnessed a journey where we also had the National Health Sector Development Framework and Strategy up to the second level of it. We're about to go to the second level. So I'm very glad to mention that, you know, for the first time in the history of our country, we have a president, President Bola Ahmed Tinubu, who is very conversant with the trend, with the journey in the health sector, but yet with the massive investment, but yet we have not realized and achieved attainment of universal healthcare coverage, leaving no one behind. So he reflected on those issues pre-election, and then he came up with campaign promises around all the thematic areas, which quickly I will mention again to remind us about governance areas. Yes, so first is about improvement on governance, to have a key, transparent, efficient, effective governance that will deliver healthcare services at all levels, federal, state, and local government level. Then the issue of human resources, address the gaps in human resources, prevent migration or reduce drastically migration, and also attract those human resources in diaspora back to Nigeria. And then he talked about financing. He promised to improve financing, and we have seen the improvement in the last 2 years. Improve financing, domestic financing. In fact, it's really surprising because as of that time, we didn't even know we were going to have a cut of the U.S. government. But His Excellency President Bola Ahmed Tinubu was very, very pragmatic in saying that we must mobilize and be independent. We must have additional domestic resources. We must mobilize within government and outside government. And we have seen in government he has played his part in improving domestic financing for health. The other aspect, of course, is the quality of delivery of health care in an integrated, comprehensive manner, you know, looking at the tertiary level, secondary level, and the primary health care level, including regulation of the private health facilities to provide quality health care services. So other aspects that we need to look at is about the public health emergencies, which falls under the global health security. So we promised that we are going to improve in early detection, you know, and then a reporting system will improve. That is the general surveillance system, and then response to epidemics and also emerging pandemics that may come up in the future. So those are areas, but in addition, I must also quickly mention before I forget, local manufacture, improve production, you know, of drugs, medicines, including basic medical equipment in Nigeria. So he will create an enabling environment that will improve production, and he has matched it within the first few months of his assumption of office, where he established the presidential healthcare value chain to unlock the potentials. And this is already ongoing. Today, we are glad to mention that under the leadership of the minister and also the coordinator of the PVAC, Dr. Mukhtar, a lot of amazing good things are happening at the moment. More than 8, I think, companies have signed MOUs. And to match that, to make it work for Nigerians, His Excellency President Bola Ahmed Tinubu approved an executive order that removes, you know, payment, value-added tax, and taxation of all importation of medical equipment, including the active pharmaceutical ingredients. So those are success stories that happened just within 2 years. You know, it's so remarkable. And then you look at other aspects of partnership, which has evolved over the period. Not only international partnership, but also, you know, domestic partnership, individuals, philanthropists. People are beginning to show interest because it is not about whole government alone, but also society and community engagement. Then looking at the areas of information generation, it's another area that we need to know where we are coming from. So there have been improvement in digitization. Policies have been developed. Committees are set up to ensure that our health sector is digitalized. We generate information. We also process information that will guide in terms of whatever we do, programming, policy formulation, and all that. So all those efforts are already in place at the moment, and we are beginning to see the results. And within the first 2 years, we've been able to see remarkable improvement, in each of these areas that President Bola Ahmed Tinubu has said. It's currently being quite operationalized under the leadership of the Minister of Health, and a lot of progress have been made that one can mention.
This digitalization, no country can really, escape it or look away from it in today's age. This digitalization, does it get to every nook and cranny where our health system has, our health sector has its systems? Because it's one thing for these facilities to be there, but for them not to get to certain rural areas. Some areas are challenged in terms of internet access, for example. Is that a concern?
Yes. So the digitalization actually will be of additional value, especially with the challenges that you talk about, hard to reach communities. Communities affected with security challenges. It's easy to deploy new technology and even a new form of delivery of healthcare services through what we call the telemedicine and using smartphones and all that. So it's doable, it is possible, because Nigeria, having passed through the COVID-19 pandemic, we've learned a lot of lessons. We've seen our major weaknesses in the health systems, especially in the area of digitalization. So you find, looking at it at the federal level, most of our tertiary institutions today are transforming from the analog form of paper-based, they are transforming into electronic record, medical record. And then we are also seeing how we can translate that, and it's already ongoing, even in some secondary healthcare facilities. So the same thing also at the primary healthcare level. So it's still work in progress. I will put it that way. It's not total, but it's still work in progress. But a lot of efforts are currently ongoing. So if you look at several aspects of transformation, there have been massive infrastructural development in our health institutions. From the report that we had from the Ministry of Health, over 500 projects have been conducted within the last 2 years in our tertiary institutions, including infrastructural upgrade, that gives them the capabilities and abilities to be able to provide services, state-of-the-art equipment, imaging equipment like the CT scan, the MRI scans have been instituted, cancer radiodiagnostic and therapy also in most of our institutions. At least 8 are functioning currently in the country in each of the 6 geopolitical zones of Nigeria.
Sorry to interrupt you, Doctor.
Well packaged and available.
Sorry to interrupt you, Doctor. Those, you said somewhere in the region of 8 are actually functioning. All those, did you have them at the beginning of this administration, or how many have been? At the beginning at this administration, the work commenced from there, so it was continuity. So what President Bola Ahmed Tinubu did was to continue with the great efforts that were already started, initiated by the previous administration. And one area is on this cancer and radiodiagnostic, which started from the previous administration of our President Buhari, and we continued and expanded on it and upscaled it. So these are ongoing efforts. Some other ongoing effort that I would like to talk about is about the operationalization of the National Health Act, which started since the time of President Jonathan in 2014 as an act, which led to the establishment of the National Health Act. Sure. Then in 2018, it was operationalized by the previous administration. So as part of efforts of His Excellency and the campaign promises he made, President Bola Ahmed Tinubu expanded the coverage and then increased funding of the basic healthcare funding. So today, through the National Health Insurance Authority, we've seen in the last 2 years a remarkable uptick and enrollment of vulnerable people, to have access to quality healthcare services at the primary healthcare level.
And that increment, I think it's over 40% increment in just the last 2 years. So those are existing efforts that have been stepped up, that have been boosted to ensure that Nigerians have quality access to quality healthcare services. And in addition, in the spirit of not leaving anyone behind, women that suffers from fistula, are also not left behind. The fistula centers that exist in the country are also strengthened. Their capacities are developed, and they've also been supported with funding through the NHIA. And women now with fistula have access to surgical interventions and also care. So these are remarkable effort that has just happened in the last 2 years. It wasn't there before, to ensure that vulnerable people are also not left behind, especially women that suffer from fistula, which is highly stigmatized in our society.
Indeed.
So it's now seen as a thing of past in terms of stigmatization. Once they have information, they know that it's preventable, and if you are a victim with fistula, it is also possible for you to have access to surgical intervention and medical care. And have your life reintegrated back to your community.
Okay. You were speaking about, the Health Act, but I also see that up to, and I see that somewhere in the region of 4 million Nigerians have actually been enrolled in the National Health Insurance Scheme in 2 years.
Yeah.
So this is a quantum leap, isn't it?
It is. It's a huge one, because if you look back history, when NHIS was established in Nigeria, I think it was in 2005. If I'm wrong, you may correct me. It was established in 2005, and we are now in 2025. How many years? 20 years since establishment, and it has been very slow progress.
Yeah.
But a lot has happened in the last few years. 2023. We now had it upgraded into a National Health Insurance Authority, and it became mandatory. So with the coming of His Excellency President Bola Ahmed Tinubu, he has boosted the uptake of services through increased financing. And a lot of advocacy has also taken place and alignment with subnational level. And states are also on the same page in terms of translation of that into action, improving. Some states have almost a coverage of 70% and above that they have enrolled, using also additional state resources to ensure that vulnerable people have access. So this is very important, the alignment, and this is one of the innovations that happened in this administration. Though I may not say it's not the first time that a president is signing a contract with subnational level, but what made it different this time around, they've signed a compact, which means they're fully aligned with the vision and priorities of President Bola Ahmed Tinubu. They've also committed to mobilize their own domestic resources into a realization of the priorities of President Bola Ahmed Tinubu. So you find that states are operating currently and are doing well, but not all states are at the same level in the realization. So some states, when you look at the issue of enrollment on the insurance, some states have also domesticated. They've also increased funding resources, and they have increased their coverage from what they used to be 20% to 70%. And states that did not even have the NHIA have currently established across the country. All states currently have the state health insurance, or some states will call it the contributory health insurance, but serving the same purpose. So these are remarkable efforts in terms of harmonization, in terms of working together, in terms of realization of the priorities of President Bola Ahmed Tinubu. So we are trying to run away from over-concentration, which is one of the weaknesses we've realized in the past. Over-concentration of powers and actions at the national level, while recognizing that Nigerian citizens reside at the subnational level, state and local government level. And I must mention, Folari, to make this happen, one of the remarkable efforts of President Bola Ahmed Tinubu is the autonomy of the local governments, giving powers to local government with their resources, because that is where action must happen. That is where we need to begin to see translation of our policies, our frameworks, our efforts at the national level, at the subnational level. So this is a remarkable one, and it has happened within the 2 years. And I always say, not because I'm the health sector, one of the key beneficiaries of this achievement or laudable initiative of President Bola Ahmed Tinubu is the health sector, because it will give opportunity for the local government council, led by the local government chairman, the local government health council, to be able to have dedicated resources, their own resources, and also mobilize additional resources to strengthen the primary health care level, to ensure that each primary health care level achieves functionality, not only in terms of service delivery, but also in terms of the infrastructure, the privacy, the security, and all commodities that are required. And this will surely redeem, hope and confidence of the citizens in the healthcare facilities within their local government level. And I must mention, following that, President Bola Ahmed Tinubu inherited through the BHCF 8,000 healthcare facilities per ward. That is, it translates to
Excellent.
1 PHC per ward. So we have doubled that. Today we are looking at 2 functional primary healthcare facilities per ward in each local government of the states of the Federation.
It's almost as if you were reading my mind, because I was going to go there, say, look, these facilities, since you spoke about, the need to spread them as far, because, these are challenges. If people have to travel too far before they can get professional and quality attention, then it begins to be defeated. So it is, as you said, facilities have doubled, infrastructural facilities have doubled, and this again must be important. So it's easier for people to access all that you're talking about, as opposed to, because people don't like to travel, not so much that they don't like to travel.
No.
It's hard to travel. If you
have a functional PHC in your ward, it means within less than 30 minutes walk, you are at a facility, and that is the maximum. But you have it at your ward, within 30 minutes, you are close to a functional primary healthcare facilities. So issues of transportation, which is one of the causes, one of the barriers to accessing quality healthcare services, will be addressed once you have a functional facility within the reach, of your home. It brings you very close to a functional primary healthcare facilities. It makes it easy for you. The funds that you would have spent in transportation is drastically reduced or eliminated. So those are some of the achievements that we are pushing forward, and then I think we are realizing the achievements, because from the reports of the Honorable Minister and the agency, Primary Healthcare Agency, over 1,000 facilities have been rehabilitated and are functional across the country. And over 5,000 are currently in the pipeline at different level, very close, advanced level, I would say, of completion to be functional.
Okay.
So in the next, I think, 2 years, before the end of 3 years, we'll be able to achieve that target of achieving the double, 2 functional PHCs per ward.
Okay. Okay, Dr. Salma Anas, let's take a break now. It's a quick one. We'll be right back, and we'll continue this conversation. And if possible, we'll also include calls from home. Do stay with us, please. We'll be right back.
The TVC News at 7 and the TVC News at 10 are not like any other news broadcast.
It's the big news hour, the hour for the big breaking stories.
Every major news story is with many perspectives and layered with different levels of impact.
Hello. What time did this happen? We will be right there.
At TVC News, we follow the big and major news, gathering the facts, witnessing the outcome.
I am here live at the aftermath of the approval of the new national minimum wage.
We are TV Station of the Year, not just for breaking news, but for being first, fair and accurate. TVC News, first with breaking news.
Doubt and fear doesn't occur at the canvas, it shows in the canvas. It shows the conation of raw earthen material slabbed, stroked and molded at a pace provided by the doubt and fear. Every move weigh in the struggle of one to the other, merging the past to the present, brushstrokes of colors seen but not known. For when the wailing stops, the pieces settle down in abject beauty erected for a century of a century. Speaking, advocating, protesting as the arts are meant to be.
Okay, welcome back, and we're having this conversation with our guest this morning, Dr. Salma Anas, Special Advisor to the President on Health, and she's been speaking about developments. We've also been hearing, perhaps on a much broader scale, the Coordinating Minister of Health in recent times, and so we're looking at some of those close areas now. And in this connection, I wanted to, you've been saying that in terms of the goals that the Tinubu administration set itself, there are some that actually you're happy to have exceeded, and others you are quite happy at how the pace at which it is progressing. So I wanted to ask that, look, what can be done without medicine? When you are talking health, you have doctors, and so there's this whole issue of the need to align pharmaceuticals with government goals. How successful has that been, aligning, pharmaceuticals with government goals? Because government goals are almost like sky high. I'm sure they are realistic, but you also have to be, you also have to be able to deliver on that. How well is that going?
Yeah. So, aligning that, it's part of the key priorities, and I did mention one of the priorities of the Renewed Hope agenda is improving the landscape in the local production, of pharmaceuticals. Yes. And then deployment of technology. So, and then the President has already shown that demonstration by creating a dedicated desk, and as said, a lot of issues are going on in the area now. About MOUs or more have been signed with government to localize importation, to localize production of Nigeria, some in the area of even HIV rapid test kits, and then in the area of even medical gas production, mosquito nets, insecticide bed net treatment. These are happening currently in Nigeria. So within 2 years, we have seen remarkable improvement because of the executive order and also the commitment that the President has demonstrated in the last 2 years. So because you cannot have healthcare without pharmaceuticals, even though we recognize the very important aspect of health promotion and disease prevention. But you cannot have a health facility, you cannot deliver healthcare without pharmaceuticals. And then the regulatory aspect of it also, which is currently ongoing through the NAFDAC, which is a regulatory agency. There have been a lot of action ongoing to deal with the pharmaceuticals that are fake in the country, production of fake, and also importation of fake pharmaceuticals in the country. And I must give a commendation to the DG NAFDAC for the efforts and the work she is doing in all crannies, corners in Nigeria, trying to unfold and ensure that we address all the menace of those, and also abuse of drugs without prescriptions. And then the NAFDAC has also been upscaled in terms of their functions to be able to regulate, and also as a pre-qualification of for local manufacture of pharmaceuticals in Nigeria. So this is very important. And if I take us back history, that's why I say history is also very important. A lot of efforts have gone in, but what have we done wrong? We remember the days when we have also the Bamako Initiative, Sustainable Drug Revolving Fund, which has not progressed steadily. We've witnessed a lot of inconsistency in that. Okay. And I must also say that issues of theft and corruption. So there must be accountability framework being institutionalized in it. And then private sectors play a very major role in this aspect in the landscape of the local manufacture and deployment of indigenous resources, so that Nigeria would be self-sufficient, Nigeria would be self-reliant in the local production. It will drastically reduce costs, associated with the importation of drugs. And then the big market, Nigeria will explore scale market opportunities beyond Africa, even to other continents of the world. So this is the future that we're thinking for Nigeria. You know, self-reliance.
Okay, Dr. Anas, there's a caller on the line. I beg your pardon for interrupting you. There's a caller on the line. Let me bring the caller in before we lose him. Sorry to interrupt you. Good morning, Mr. George.
Good morning, Uncle Yori.
Thank you for calling.
Good morning to the Honorable Minister.
Well, she's the special advisor to the President on health.
Oh, all right. So
Dr. Salma
Anas. She was the Minister of State.
No.
Madam, good morning. I want to thank you for what you are doing. I remember the last time you appeared on this program, I was the one that called to ask you about the alleged missing fund of NHIS. And I remember the answer that you gave. You know that until I heard you speaking now, I didn't know as many as 4 million Nigerians have now been enrolled in that scheme. Well, it wasn't up to that number before, but 4 million is still quite a number. It's still quite some progress. I want to urge you and the ministry to see how it can be improved upon, how the budget can be increased, because 4 million out of about 220 million people is still a far cry. But it is good that you are moving it forward. The other thing I wanted to let you know is about publicizing what you are doing. People like my friend Uncle Yori, they have to eat now. They have to also make money. Is it that your ministry or the Ministry of Health does not want to pay them? People are not aware of these ones that you are reeling out this morning. And they need to know. Those who are saying nothing is being done are having the upper hand because they are not hearing your side of the story. Please, try and address that issue. Okay. And I wish you more strength as you continue the work. Thank you, ma'am.
Thank you very much for calling in, Mr. George.
Thank you.
And well, as he was saying, you know, you might not have remembered, but he did call in. He calls in on just virtually most of our programs. He's not the only one. But he referred to the Office of the Minister of State for Health, and the Minister of State is Dr. Isiaq Adekunle Salako. And, you know, just to put that in perspective, working together with the coordinating Minister of Health and Social Welfare. Okay.
Yeah.
He was saying there that, well, I guess this is why you come from time to time to let us know. But is there anything, is there a way in which you could sort of minimize the distance between these calls, or somebody in your office, your communication office, or do you think, because it is, we do get information from the Minister of Health, he has a machinery, is it the same, or would you say that if you're hearing from that sector, you can't say we're not hearing from the Minister of Health, from the Ministry of Health?
So I take that as an observation that we need to improve upon communication to Nigerians, you know, where the services are available in their respective states up to local governments, and then what government is doing and how government is translating the priorities and achievements of the president, also in alignment with the subnational governance. I think much work needs to be done in that area to enhance the visibility of the efforts of President Bola Ahmed Tinubu's administration. So I take that as an observation, and I've taken note of it, that there will be information, appropriate and accurate information dissemination that can be verified at all levels.
Okay. So what is a Ministry of Health if it doesn't have doctors? And over 16,000 doctors are said to have left Nigeria in the past 7 years. That's, you know, according to newspaper reports. And I've also seen another...
6,000 doctors, 6,000 doctors.
Only 6,000?
All healthcare providers. Yeah, maybe all healthcare providers, not only medical doctors are doing JAPA, but other healthcare providers like nurses, massively, midwives, even pharmacists, health technologies, even auxiliary healthcare providers.
All of them
are moving. So when you put all that together, it gives you that number.
Maybe, thank you very much for that clarification. But when we have this kind of a situation, are we replacing? Is it that some go and they are being replaced by others? How much of a challenge is this?
So I must say it is a huge challenge, and it's grossly affecting delivery of quality healthcare services in Nigeria. But let us also know that this is not only happening in Nigeria, but Nigeria is not spared. It's a global phenomenon happening everywhere, across the globe. So we have recognized that, and we realized that at the initial stage, even during the campaign period. And that's why, if you remember, I mentioned that human resources for health is a key pillar of President Bola Ahmed Tinubu's priorities. So what we did, as soon as this government started, there has been a policy that was approved by His Excellency President Bola Ahmed Tinubu on workforce migration. So how do we ensure that we increase production of healthcare providers in the country, in terms of, and also the quantity in terms of numbers, because the numbers are grossly inadequate across all the cadres of healthcare workers. So there is need for increased quality and also increased production of the number, but also enabling environment. Because if you look at what are the drivers that healthcare providers leave the country, so mostly it's about working environment, mostly it's about their remuneration. They feel they don't have the right infrastructure, modern equipment to work with and deliver services within Nigeria. And also some will tell you it's because of also remuneration, poor remuneration in the country. There have been several promises in the past that were not complied with in the country. So there are several reasons. So and then workload, they are overburdened with the work, and then they are not also being acknowledged as contributing to healthcare delivery. So if you look at it, we try to address all the issues. In terms of the numbers, when this administration came on board, there have been improvement in the number of production of medical doctors in our tertiary institutions, and also in nurses and midwives. That has almost doubled for the nurses and midwives in the tertiary institutions that are within our federal teaching hospitals. But also there have been attraction and investment by the private sectors, and you have seen a lot of private health facilities that have come up in the last 2 years, within the last 2 years, owned by private sectors, being regulated by government. So those are areas we've done in order to improve also production. And then I've mentioned about the improvement of the workplaces in terms of investment in infrastructure, investment in modern technology in our tertiary institutions. So this has been, they have been massive, I mentioned. So those are aimed to ensure that we have the basic equipment, the modern state-of-the-art equipment that will help retain our healthcare workers, and at the same time also reverse medical tourism. And I'm glad to mention, including private health facilities, there have been new private health facilities, and those that exist have also stepped up in terms of their capabilities, their modern equipment. Following, I'm glad to mention to you, maybe we need to do more of visibility and documentation in terms of medical tourism. Medical tourism, we are beginning to witness a reversal of medical tourism, though it might be in limited number that Nigerians might not see. You visit some health facilities I have seen. I have visited facilities here in Abuja, and I have seen, like Nizamiye Hospital, which is a privately owned facility. Patients are coming from even Canada. I have seen on their record, they had patients that came from other countries, developed countries, and then in addition, a lot from our neighboring countries, and they are doing successfully well in delivering services. And then you take even another one that is fully indigenous, like Cedar Crest. I'm not marketing for them, but we have seen. Of course. And the information is also there for you to verify. And not to talk about facilities in Lagos State that are privately owned. So a lot of efforts are ongoing. Maybe, as you said, we need to look at our communication strategies. And I think this is one of the weak areas that we have as medical health personnel in terms of advertising. Yes, advertising and showcasing ourselves. We are not good in that. So we need help to be able to do that. So, so the efforts, and then massive capacity building. And one remarkable thing that His Excellency did in the area of human resources, recently, he has increased the age of retirement for medical personnel from 60 to 65 years. And this is highly commendable. We have been on that for a very long time to get different leadership to be able to change that trajectory, that narrative. It did not happen until when President Bola Ahmed Tinubu came, looked at it critically and objectively. Because we cannot be crying that we don't have healthcare providers, while we have those that are 60 and above and very active will be able to continue to provide services, and we are retiring them. So we highly commend that his efforts, and this is a great achievement that will also ensure that we have reliable healthcare providers that will stay in the country and continue to provide services. Then looking at also improving the enabling environment, you know, and attracting healthcare providers that have Japan or those that have gone long time ago and are doing very well in abroad. You know, Japan started in Nigeria a long time ago. So you remember the time of Andrew is checking out? You remember?
Yes,
and,
yes.
You recall that I'm checking out, you know? So this has been a trend. This has been a trend. And then we are being exploited by countries that are developed because our training is up to standard, comparable anywhere in the world. So they like to have Nigerians to be in their countries to deliver because it's cheap labor.
Well, Dr. Anas, as you are speaking, I'm remembering. As you are speaking, I'm remembering that how I wish I had the name. Even specialists, you know, doctors from America. Some of them are patriotic enough to uproot themselves, haven't spent decades over there, and are saying that they are now coming back home to add their own quota.
Yes,
I mean, you know.
Thank you.
It can only be that they're observing what's going on, and they say, "I want to be part of this."
Yeah, good. So a lot of them it's about the environment, the efforts they see of the president, you know, the renewed hope health agenda. You know, there is a new hope in Nigeria that things will be better, and it's been better, and we have demonstrated in the 2 days that things are getting better. So a lot of them that have Japan, like 20, 30 years ago, they want to come back home. They want to come back and contribute home, at home. So we are working closely with the Diaspora Commission to attract them back, and then with the good environment, a lot of Nigerians are coming back to work in Nigeria and also contribute their own quota. So at the end of the day, what I would like to say, we cannot totally ban, you know, migration of health workers, but we can reduce it to the minimum level that will have any public health impact or be of threat on the citizens of Nigeria. And this is the ongoing efforts that is happening at the moment.
You know, renal facilities, that's another area. I mean, now I know that, of course, we would concentrate on public health most to spread it to as many people as possible. But there also are these specialist services in the area of dialysis, and I'm hearing that we now have state-of-the-art facilities, and people with confidence can actually access those facilities. Of course, you know, it might cost a pretty penny, but how is this balance that, look, you now don't have to travel, you know, out of the country, you know, well, I shouldn't say it like that. There are now options within the country, is probably a better way to put it, than what used to be before. But how does one balance it with costs?
There are several options. There are several options in the country. And what I presented earlier was on the vision of President Bola Ahmed Tinubu is to ensure that this administration provides healthcare services, you know, in an equitable, efficient, and effective manner to all citizens, with a view to attain the universal healthcare coverage. No one will be left behind. So if you look at the vulnerable people, the poor people that cannot pay, these mostly women, children, the poorest of the poor, including men, because men are also part of the poorest of the poor in Nigeria, the elderly people, and also people with disabilities will have access. So cost will not be a deterrent or a barrier to access quality healthcare services in Nigeria. And this is what I have mentioned, that His Excellency increased the budgetary allocation, increased allocation for health. In the last 2 years, it has been increasing up to 2025. We have seen some modest increase. And he has also expanded the insurance coverage. so that more vulnerable people will be able to have access to the insurance coverage, within their own communities. And also part of the specialized care, I did mention about the fistula, which has been going on through the NHIA, including also access to renal dialysis is part of it. For those that require renal dialysis in the selected hospitals that have been identified and upgraded. So those services are also available. And we did talk about upgrade of infrastructure in our tertiary institutions.
That's right.
So that does not cut off the vulnerable people. The vulnerable people will also have access. They are also included in it through the basic healthcare funding expansion under Health Insurance Authority.
Well, Dr. Salma Anas, I want to thank you very much for coming on and telling us about this. And also, we're delighted at your sort of resolve to see what you can do to further, expand the communication of some of the, nice things that you're talking about. And here we are at midterm. I think by most accounts, there is stuff to report on. And I can then imagine, as you were saying, by the end of the third year, going to the end of the first term of President Tinubu, only God knows where we will be. But certainly, it will be a far throw from here. Thank you very much for coming on our program today. We're going to have to leave it here for now.
Thank you so much.
All right, then.
Bye.
All right, then. So we're going to have to leave it there. Do please join us tomorrow for a fresh edition. I am Iyori Folarin. Bye-bye for now.
Media Impact lovers, we have good news for you. In the quest to keep Nigerians abreast of the happenings in the digital space, Media Impact, a flagship TV program of the National Information Technology Development Agency, is now showing here on Television Continental. It is, as always, educative, informative, and innovative. Media Impact. Keep a date with Media Impact, your guide to a digital Nigeria.
Martin Luther King Jr. was born in Atlanta, Georgia, January 15, 1929. The son of a Baptist minister, King received a doctorate degree in theology and in 1955 helped organize the first major protest of the African American civil rights movement, the successful Montgomery bus boycott. King participated in and led marches for the right to vote, desegregation, labor rights, and other civil rights. He advocated civil disobedience and nonviolent opposition against segregation in the South, influenced by Mahatma Gandhi. The peaceful protests he led throughout the American South were often met with violence. Nonetheless, Dr. King and his supporters were persistent and the movement gained momentum. Dr. King was a powerful orator. He appealed to Christian and American ideals and won growing support from the federal government and Northern White. In 1963, Bayard Rustin and A. Philip Randolph led the massive march on Washington for jobs and freedom. The event's grand finale was King's famous I Have a Dream speech. 250,000 people gathered outside the Lincoln Memorial to hear the stirring speech. In 1964, the Civil Rights Movement achieved two of its greatest successes: the ratification of the 24th Amendment, which abolished the poll tax, and the Civil Rights Act of 1964, which prohibited racial discrimination in employment and education and outlawed racial segregation in public facilities. In the same year, King became the youngest person to win the Nobel Peace Prize. In the late 1960s, King openly criticized U.S. involvement in Vietnam and turned his efforts to winning economic rights for poor Americans. He was a leader of the American Civil Rights Movement and organized a number of peaceful protests as head of the Southern Christian Leadership Conference, including the March on Washington in 1963. He was assassinated in Memphis, Tennessee on April 4th, 1968.
on labor lens are ensure we engage effectively the organized labor, organized private sector and government to get out of them information workers are in need of. I am Sharon Jackson, asking questions that make you get sense of the workplace.
Every second, every minute, every hour, and every day, time doesn't just tick away.